Hello, everyone following ITI online symposium in front of their computers. Today, I will be talking about the extended edentulism in the aesthetic zone and how to approach those patients from prosthetic and surgical point of views. My name is Duygu Karasan, and I'm working in the University of Geneva in Division of Fixed Prosthodontics and Biomaterials. And as a summary for my presentation, I will be talking about what clinical scenarios we see for those type of patients and what are the associated challenges. Also, how to approach those patients prosthetically and surgically. Finally, what are the alternatives for materials and abutment for definitive restorations. Extended edentulous spaces can be various. We can have different distributions of the edentulous gap. It can be symmetrical, asymmetrical, and at the same time, the patient can come with already teeth extracted or they need to be extracted. And the associated challenges are quite related to those scenarios. For example, the asymmetry is one of the challenges that I would like to address is quite important because we know that asymmetry is crucial for aesthetics, and usually for prosthetic treatments, we would like to mimic the symmetrical side of the art. But in those kind of patients, to try to actually copy the other side is quite challenging, especially in pink and white aesthetic aspects. And the second challenge is the ridge alterations. We know that vertical and horizontal dimensional changes occur after the tooth loss, and this results in flattened soft tissues.